gluten and even dairy in certain cases is very inflammatory to the body. So some people, if they can have joint issues, skin rashes, really bad gut problems if they continue to have gluten and dairy. And so in certain instances, it can actually be a really good starting treatment option to avoid gluten, avoid dairy, and then see how your symptoms do, especially your chronic symptoms. So I put this up here because this is a very interesting ingredient label, and you'll see the number of different artificial chemicals and so on. And this is, if you take a guess on what this is basically a Twinkie. And so I mention this because sometimes we don't realize this artificial food that we're eating, how many artificial ingredients are actually here, and how damaging and dangerous they are. So this is something, if you see an ingredient label that's this long, it's better to avoid it. The smaller the ingredient label, the better. And then I included this slide because it's very interesting how they have found different ways to add sugar into our foods. So they will use these different names. And so there's over 75 different names for sugar. So, all of these, I won't go through all of them, but all of these, like maltodextrin and stuff, when you see this is all referring to sugar. And it's better to avoid this as much as we can. So this, so it's a very important point. Now, going on and talking a little bit about the lifestyle component, because we talked about diet. The lifestyle component is extremely important because, with the diet, we should have a good movement regimen. We should be focusing on some type of physical exercise. We should be working on stress because stress, we now know, contributes so much to chronic disease that we need to really work on stress levels. And it's not easy, and it doesn't mean that you have to remove all stress, but it does mean manage it well. Sleep is very important, so ensuring that we get not only the right amount of sleep, but the really good quality sleep. Relationships and communities. So this is something that the mosque obviously stresses, our faith stresses the importance of community, close relationships. We now know that things like loneliness, they actually have a significant impact on our physical health. Something like loneliness is the equivalent in physical terms to smoking 10 cigarettes a day. That's the effect of loneliness on your physical health. And they've been able to quantify this through their research. And spiritual health is obviously is a given. So just a few last slides and then we can wrap up. I get asked this often about supplementation. Should you do it? Should you not? So I definitely use supplementation in my practice, and the pros are that it's definitely a more natural approach. There are less side effects in general, and the supplements, they tend to support pathways. And what this means is that supplements will actually contain items that actually will support you rather than medications which tend to block different reactions and different enzymes. The cons, there are some cons on supplements. They can be very expensive, and you can get to a point where you then have a very long list of supplements that you're taking. And instead of 25 medications, if you end up taking 25 supplements, that doesn't really solve the problem. So that can become a problem. So that's supplementation. A quick point on medications. We try to be as holistic as possible, but sometimes you have to use certain medications, so sometimes necessary, obviously. If you have high blood pressure or diabetes, there's instances in which that can be important and need to be used. Should be used as minimally as possible, so it's important not to go to a physician and the first thing that you're recommended is just to be put on prescriptions and without having discussion on diet, lifestyle, and so on. Significant side effects, as you all know, there's so many side effects to certain pharmaceuticals. They can be very expensive as well, as we know. So certain ones are not covered by insurance. Pharmaceutical medications, you don't need me to tell you, the industry is all about profits. And so that's a big problem with medications as well. And this is a point that certain hormones, like thyroid hormones or so, I'm differentiating them from pharmaceutical medications, however. But that's a separate issue. I wanted to include just two last slides. One was on mental health. This, I think, is important to not be excluded from our conversations around health. We keep talking about physical health, but mental health is very important. We also need to normalize discussing mental health in the Muslim community. A lot of us come from different cultures and backgrounds that tend to view mental health as a very taboo topic and something that shouldn't be discussed in the mosque or something like that, or shouldn't be discussed within families. And we really need to get away from this. We need to start talking about this because Muslims are as amenable to any other population. So I was going to say that that we come from these backgrounds and where it's so difficult to be speaking about these in a family setting, in the mosque setting, in the Muslim community setting, and we really need to open up these discussions, dialogues. Certainly our religion does not shy away from these important topics, no matter how uncomfortable they might be to people. And we also need to have a dedicated Muslim professional therapists and psychiatrists who understand our unique cultural and religious background. And as you know, with the therapy community nowadays, if you take someone to them, there's a whole agenda behind that. And that's a big problem. And so we need to have good Muslim therapists, good psychiatrists who understand the values that we have, that understand our worldview, and can then treat, especially adolescents, because that's a very, very fragile age, so that they understand the values that we're coming with. Otherwise, there's a big problem with the parents, and the therapists. There's a big breakdown there, especially with gender and everything else. So that's a whole issue on its own. And then a holistic approach should be taken when treating mental illness, not just a prescription focus. So a lot of time you will go with a mental health issue to a psychiatrist, such as saying that you have depression, and the first thing that the psychiatrist will do is put you on an antidepressant. And if that doesn't work, they'll switch to a different antidepressant and another one. And so what I tell people is that depression is just a name for the illness. It doesn't tell what's the underlying issue. One person's depression could be from a deficiency in iron, another person's could be from a vitamin D deficiency, another could be from actual chemical imbalance and something going on in the brain. And all of those patients should be treated differently. So that's where a holistic approach is very important in treating mental illness, not just prescription. And last slide I just wanted to mention was cancer screening. So this is becoming more and more important to talk about because the main two cancers to screen for are colon cancer and breast cancer. So the recommendation has actually moved backwards from 50 years old to 45 years old. So as you've probably heard in the news, a lot more focus around colon cancer. So they've changed the recommendations from 50 to 45. So any person, regardless of their health at 45, should be screened for colon cancer with a colonoscopy, and then it gets performed every 10 years. There's recently a lot of headline news with Kate Middleton, who had developed cancer, which seems, I don't know if she said it was colon or not, but it seems colon cancer. So just a lot of these, high-profile personalities that are developing this, and that's leading the discussion around colon cancer. Certain people that are at higher risk will have to have it more frequently on the guidance of their physicians. So that could be every 3 years, every 5 years, depending on genetics, depending on history. And then breast cancer is also very important. Females age 40 onwards should be receiving a mammogram every other year. So that's very important to make sure, for the women, to make sure that they get regular screening as far as that goes. I get this question about prostate cancer a lot, about either the rectal exam or the PSA screening in the blood test, which is the prostate-specific blood marker. Now they've gone away from screening for prostate cancer. The reason is because a lot of these tests are not very specific, and you often get a false positive for these tests, and then the patient ends up getting a biopsy unnecessarily. The biopsy is negative, and then they can end up with complications like infections and so on and so forth. So prostate cancer, not recommended to screen routinely now. So I will stop here. I think we have